Private members' business. Next order of the day, National Critical Care and Trauma Centre. Resumption of debate on the motion of the member for Solomon.
Question is that the motion be agreed to. I call the member for Solomon.
Thank you, Madam Deputy Speaker. I rise today to bring to the attention to the House, through my motion, the need to recognise the National Critical Care and Trauma Centre based in my electorate. An outstanding facility born out of the horrific 2002 Bali bombings. The National Critical Care and Trauma Centre was an initiative of the then Health Minister and now Leader of the Opposition, the Honourable Tony Abbott, who remains a champion of this essential services to this day. The 12th of October 2002, a day that will forever haunt Australians and Indonesians. It's one of the darkest days in our joint history. For Territorians, the attack on Bali was not only an attack on one of our closest neighbours, it was an attack on a place that we love and visit so often. I'm told some 20,000 Australians can be in Bali at any one time. 10 years ago, 202 people killed, 88 Australians and 38 Indonesians among the victims of the Bali bombings. Another 240 injured, many suffering major burns. Many of the injured were transferred to Darwin Hospital, the Royal Darwin Hospital, and it's largely thanks to the incredible staff at the hospital and their efforts that many of the people are still alive today. Within 62 hours of the bombings, Royal Darwin Hospital medical staff had resuscitated 61 patients, including and evacuated 48 patients to burns units across Australia. In total, over 100 patients were treated. 70 of these were critical. Former Prime Minister John Howard said recently of the staff that the response organised through the Royal Darwin Hospital was a triumph of what I think can be described as the gentle efficiency of Australians when faced with great crisis. It's important to acknowledge the Royal Perth Hospital staff as well, who treated 28 burns victims after the bombings. And it's widely accepted that while both the Royal Darwin and the Royal Perth hospitals carried out outstanding work, neither hospital were resourced well enough to handle the scale of this terrible tragedy. And as I said earlier, the now Leader of the Opposition and the then Health Minister, the Honourable Tony Abbott, oversaw the foundation of the National Critical Care and Trauma Centre. He said at the time that the centre would provide not only the Northern Territory but Australia with a first-class national health emergency response point to deal with disasters and major incidents in our region. According to the official website of the National Critical Care and Trauma Centre, the centre contributes to the Northern Territory economy by injecting $9.2 million a year, funding 58 medical, nursing and allied health positions and offering more than 1,300 training places. The establishment of the National Critical Care and Trauma Centre has enabled our ability to respond to incidences in the region, as was the case with the second Bali bombings in 2005, with the 2008 assassination attempt on East Timorese President Jose Ramos Horta, the 2009 Ashmore Reef Civ 36 incident, and the Pakistan floods in 2010. Much of the National Critical Care and Trauma Centre's success is due to the Executive Director, Dr. Len Nataris AM. Dr. Nataris coordinated the hospital's response to the Bali bombings in 2002 and was awarded membership to the Order of Australia in 2003 in recognition of his outstanding work. It's important to also acknowledge Dr. Didier Palmer, Director of Emergency Medicine at Royal Darwin Hospital, and Dr. Gary Lum. All three men were instrumental in the foundation of the National Critical Care and Trauma Centre, and I understand that they continue to this day to be strong advocates and champions for this ongoing support and funding of this essential services. Now, I call on the government to ensure that there is wide acceptance of the outstanding clinical and academic leadership of the National Critical Care and Trauma Centre. And I call on the government to guarantee ongoing support and funding of this essential facility within my electorate. I commend the motion to the House.
Thank you.